This was my identity.
Nobody talks about how freaking hard it is to be a dentist. What most people talk about is how this affects the patient. What nobody talks about is how this affects us. Dentistry is ready for this. Now is really the time.
Welcome to Wellness and Dentistry, where today we're going to be talking about the guilt cycle in dentistry. I'm joined by my good friend and co-host, Dr. Kyle Stanley, who is a dentist, tech entrepreneur, speaker, and researcher. And I'm Dr. Martin Mendelson, a disabled dentist, coach, speaker, and author. And my first book, One Move Makes All the Difference, is available wherever books are sold. And together, we've helped thousands of dental professionals pursue wellness and dentistry. And if you're unfamiliar with us, we invite you to check out our respective links, websites, and course offerings on our combined website called wellnessinDentistry.com. So, Kyle, we get to talk all about guilt today. How fun
Isn't
is
that
that?
fun? Isn't guilt fun? Well, guilt, I've had it, as
Yeah,
everybody has. And
sure.
I've definitely had it as a practice owner, as a dad,
Hmm.
as a husband, as a friend.
Yep.
And I think for me, my guilt really started when we bought our practice.
Hmm.
And then we were really trying to get things better. We were trying to organize things. We were trying to improve systems. We were trying to raise the production, get new
Hmm.
patients. And I have two partners as well. So it was kind of like I have my work husbands and I have
Hmm.
my wife at home, right?
Yeah.
And
Yeah.
both of them want my time.
Yep.
And that was when it first started. It was really before I had kids. And I could think of the first time, which was when we were redoing our practice. Okay, so we did this crazy thing where the goal was to completely, I mean, bring our practice down to the studs, all right?
Hmm.
It's not a big practice, right? 925 square feet, but bring it down to the studs during Christmas break. So
Hmm.
we're only taking off like 2.5 weeks.
Hmm.
Very fast, right? And sounds cool, we're not going to lose a lot of production. Now, what happens in those 2.5 weeks is number one, we're on the ninth floor. When they go to do construction, they forget to turn off the water at night. And so we flood the 3 floors below us.
Oh, God.
Number two is Christmas is happening for my family. We celebrate Christmas. So we're going to my wife's uncle's house. We're going to my parents' house. My wife and I had only been together. We were married at this point. We had only been together for a few years. Um, and she's like, "Well, it's Christmas. Like, I need you to be here with me."
Yep.
And I'm like,
Yep.
"But we're redoing the practice. Like I've got to be there. I've got to watch over people. We had a freaking flood that's happening. Like, and I felt so much guilt wherever I was.
Hmm.
When I
Hmm.
was at home with my wife or when we were, doing holiday stuff, I felt so much guilt towards my partners because they were there.
Yeah.
And then when I was at my practice, I felt so much guilt about, not being with my wife.
Hmm. Hmm.
And it only got worse for me when I had children.
Yeah.
Because then it was someone who really needed me, didn't just like want me, but like
Yeah.
needed me there, right?
Yeah.
And I always felt like for those of you that are watching, I'm gonna put my both of my legs really wide, but I always felt like I had one leg at my practice and one leg at home.
Yeah. Yeah. It's a huge challenge. And part of that is real and part of it's mental, right?
Yes.
Because part of it is true. You can't, listen, you can't be in two places at once, right?
Yeah.
So that's absolutely true. While at the same time, there's a lot of made up guilt that we self-impose upon ourselves. I once heard a therapist say guilt is a self-imposed emotion, which I think,
Mm.
yeah, and so
Can you expand on that more?
yeah, I mean, so you made a choice at that moment, if you
Yeah.
will, that you were going to be at the practice.
Hmm.
And so you were thinking that you wished you were with your family. So you were telling yourself that, oh, I should be at my family. You were, shooting all over yourself, as we love to say. Thanks, Gary DeWood. And while at the same time, you did need to be in the practice overseeing what was going on. So it's all about your thought processes, if you will, relative to I guess you could say also recognize the reality of the situation. It's like, okay, so I want to be home with my family, but I have to be here, right? And so if you're going to choose that, then go ahead and choose that, but also vice versa, right? So it does come down to a large degree on being honest and true to yourself relative to what is most important to you in this moment, right? But that doesn't remove the responsibility of communication to, in your example, to your spouse, to Brianna, like you would need to have that conversation, right? So it's not like it's giving you a free pass, and I don't want to be misinterpreted. What I'm simply saying is that you got to realize that a lot of this stuff we're making up in our head, basically.
Well, it's funny, as you were saying that, I was writing a few things down, and
Hmm.
one of them was, well, let me go back a little bit.
Hmm.
When this instance happened, when this
Hmm.
feeling of guilt started,
Hmm.
I hadn't gone through my personal growth journey yet.
Mm. Yeah.
I wasn't focusing on being present. I wasn't focusing on boundaries, expectations,
Hmm.
and communication.
Yeah.
None of that had really come into my mind yet. I was
Yeah.
just like, do the best dentistry I can,
Hmm.
measure in microns,
Hmm.
make good amount of money, you know,
Hmm.
be the most famous implant dentist that I could. That was
Yeah.
like seriously my thought, which is so silly now. When I look back on it, I made a lot of mistakes in that. Like you were saying, it's funny when you
Hmm.
said guilt is a self-imposed emotion, I'm the one that caused that guilt
Yeah, 100%.
because I didn't set the expectation
Hmm.
one
Yeah.
way or another, right? So
Yeah.
let's say it was about going to family Christmas time.
Hmm.
I could have talked to my partners and said, listen, guys, I'm going to be here all the time when we need to,
Yeah.
but on Christmas and Christmas Eve, I'm going to be with my family.
Totally. And that also goes with talking to your wife too,
Exactly. That's what I was
relative.
going to say. Same thing
Yeah.
is like, even before we started that construction, what I should have said is, listen, this year, unfortunately, Christmas time is going to be different.
Hmm. Hmm.
I'm going to be there at this time and this time. But other than that, I kind of have to be at the practice. You know, I'll be going back and forth, but it's not going to be like normal where I'm off
Yeah.
and home helping and we can do Christmas shopping and all this stuff together.
Yeah.
And so it's like I impose that guilt on myself because I didn't set that expectation.
Yes.
Now, the
Correct.
second thing that I wanted to say too, now that I've gone through this personal growth journey, is I wasn't focusing on being present.
Hmm.
So when I was in the practice, I wasn't truly all there.
Hmm.
I was
Hmm.
just thinking about all the stuff I'm missing at home. When I was at home, I
Yeah.
wasn't truly there. I was thinking about, what my partners are going to be saying about me behind my back because I'm the partner that's not trying as hard.
Hmm.
And so they really go together now that I'm just saying it out loud is if you set the expectation, you're much less likely to have the guilt and you're
Hmm.
much more likely to be present.
Well, and you're being much clearer with yourself and with others as well, right? And so I actually had something happen Saturday, which I haven't even gotten a chance to tell you about yet. And it's a perfect example of this. And I didn't even think about it when we were talking before we hit record, but it is I hate to say this is so bizarre. It is my 30th dental school reunion this year.
Wow.
And I am going, wanted to go, excited to go, maintain relationships with a lot of my classmates. And I went to the Baltimore College of Dental Surgery, which, if you know that geography of the world, it's right, next to DC. It's pretty close. And so if anybody's heard me lecture in the last couple of years, when I talk about my team framework, I talk about my best friend, David.
Yes.
Well, I had already talked to David. He was going to drive up to DC. We were going to hang out. We are going to go
Oh,
out. We are going to have
oh,
a
but
great
David's
time.
not from your class though.
No, no,
No,
no, no.
because he's a hygienist, right?
Correct.
Yeah.
So yeah, he's faculty at VCU. He's getting his PhD.
Yeah.
So yeah, so he was going to drive up from Richmond to DC. So basically, I was going to go to my reunion in Baltimore, see some family on Michael's side, and then go to DC specifically to see David and see some other friends as well who I'm very close to. And I realized, much to my horror, that I had an overlap with a conference of an organization that I'm a member of that I had already committed to going to, but I wasn't speaking at. And I've volunteered at this organization in the past and so forth. And I got so upset because I was like, oh my gosh, I can't be two places at once. And I've been that person that has foregone the personal stuff to do the professional stuff.
Yeah.
Right? And I said, nope, not this time.
Mm.
And I made the decision to do the personal thing. And I feel really, really, really good about it because I'm honoring what's important to me rather than saying what I should be doing. So maybe that's an important point there, Kyle. Maybe a tool is to say what's really important to me right now.
Well, yeah, it's funny, and you and I talk about this in Lightside Live too, is once you get your values,
Yeah.
once you know what your values are,
Yep.
and then once you prioritize them,
Yep.
these decisions become very easy.
They do.
I
Yeah.
mean, simple, not easy,
Yeah,
right?
as I love to say. Yeah. It is.
Yeah, I learned that from you. Is they
It
become
is.
simple. They should
Yeah.
almost be binary.
Yeah. And I think this decision that I was just describing did become binary. It was like, okay, I want to go to this meeting in it was in California actually, and I'm not speaking, and who's not going to understand that I want to go to my 30th dental school reunion? Like,
Right.
seriously? So, but I got news for you. Even if I was speaking, I probably would have figured out a way not to. Um,
Hmm.
because it was really important to me. And I felt so crestfallen that I wasn't gonna see my dental school friends, see some family, see David, see other friends. And it felt wrong. It felt not in a, grandiose kind of way, but it just didn't feel right for me in
Hmm.
that situation. And so I made the choice, right? When I'm in DC, might or at my reunion, either or, might I think about the meeting in California? Sure, I'm sure I will. Um, and I'm also going to think about the choice that I made to be in the place that I'm in versus the other side of the country. So,
I'm interested to hear if you remember any guilt cycles from when you were practicing.
oh yeah. There were, in fact, in particular, I remember working several Fridays after Thanksgiving when my family was in town.
Mm.
So there you go. That's one, right?
Mm.
Um, because I think to a large degree, and we've talked about this on the podcast in the past, and granted, I was an associate, so it wasn't appropriate for me to plan. Well, actually,
Right.
that's not true. That's not true. Um, but
Well, it's more challenging, right? When you
it's
have a
more challenging.
boss.
Yeah, yeah, yeah. But it's we all seem to feel like, well, I can't do that because X or Y or Z is going to happen. It's like, well, who the hell made up that rule?
Yeah.
It's this made up guilt thing that we've already talked about or already shared the idea around where, well, I can't do that. I have to be there. Really?
Hmm.
Why? Like now, again, great respect to associates. You may not have a choice, right? But the question's still valid, which
Yes.
is who made up that rule? So, and for example, let's pretend just for a moment that you're an associate, the practice is supposed to be open. Everybody knows, at least in the US and in Canada for their Thanksgiving, like the day after, not a lot happens, right?
No.
And most dental emergencies are not
True
true
emergencies.
emergencies.
Yes.
And many of the ones that are true, frankly, have a lot to do, not always, the trauma and accidents aside, have to do with people's not doing what they need to do on a regular basis. So do we really need to be open on that Friday? And then if the answer is then, well, that's what we planned and or that's what we've done in the past. Well, let's say, for example, you typically work 4 days a week. Well, what other week within a 30-day period can you work to quote make up for it if the plan was already in place? For example,
Right.
if you were already in that year is kind of what I'm saying.
Hmm.
So the answer from ownership may still be no, while at the same time, at least we are giving ourselves enough respect to at least attempt to find a solution to honor our values and honor what's important to us, right?
Yeah.
Is what I is now granted, I'm saying that as an older, more mature person that's been through this stuff, that's been sitting there at the office or on an airplane or in a conference thinking, why am I not at XYZ?
Yes.
So take it from me, I've done that too many times to really understand what's really important to me in life.
Well, there's two other examples that I want to give you with this
Hmm.
guilt cycle, and some of it I still have guilt about. Number one is missing my wife's great grandmother's funeral.
Yep.
I was just a few years into my office, maybe 2 years in. I think we had finished our remodel that I talked about
Hmm.
earlier in the episode, and it was my wife's grandmother's funeral.
Hmm.
Now, I had met her one time before that, maybe twice. So, I didn't know her well,
Yeah, yeah.
but it's my wife's great grandmother. Like she
Yeah,
knew her well.
yeah, yeah.
Um, and I didn't go to the funeral.
Hmm.
I worked.
Yeah.
And I remember, I'll always remember this. When she got home, she said, everyone was asking me where you were. And I said, well, didn't they know I have to work? Like, I have to
Hmm.
work. And I still have guilt about that.
Yeah.
It's, I think I had prioritized my partner's needs over my wife's needs.
Hmm.
And honestly, if I told my partners, hey guys, I can't work, it's Brianna's great grandmother's funeral, they probably would have been like, okay, okay, yeah, go ahead.
Yeah,
You know,
exactly. Yeah, yeah.
but I assumed that it may be, well, you're never here, and you're the partner that doesn't work as much as all of us, and it's crazy to think that I did that.
Well, here's the thing. A, one of my other favorite phrases, we all do the best we can with the skills we have at the time. And B, the true mark of maturity is learning from these missteps and either not doing it or growing because of it, not doing it again
Hmm.
or
Yeah.
growing because of it. And obviously, this misstep on your part means something to you and it taught you a life lesson that you're not going to repeat.
Yes.
So it served you to a point
It's true.
in a lot of ways for you. So
Yeah. The other guilt that I want to talk about that I used to be so bad at, and that I know many dentists that take our courses are very bad at, is taking every emergency patient,
yeah,
or even just accepting every patient that comes into their practice.
yeah.
And what I want to say is, I get it. I understand you. I know where it's coming from, and I know that it comes from a good place.
Hmm.
We don't take everybody and accept every emergency patient and stay late for them and go on our lunch break because we're mean people. No, it's because we're great people and we're
Yeah,
just trying to help as many people as we can.
yeah.
But at the same time, I want to say that it's not sustainable. It's
Mm,
not the best thing for your business, and it leads to more burnout over time.
totally.
And so I want to give people the out that are listening to this. You don't have to see every emergency patient. Like Martin said, most emergencies are not true emergencies.
Oh, and I got a good story on that one.
Let's hear
Um,
it.
When I was younger in practice, this woman called. When you hear the end result, you'll understand why I'm about to say there's no way she had been in recently. Um, Although she had to have been a patient of record, or else I wouldn't have gone in on a Saturday. Um, she apparently chipped her tooth. Now, I have to assume I asked her because I don't remember if she was in any pain. And if I did ask her that and she answered, either she had to have said no or she wasn't being truthful because I came in and you know what I discovered the fractured tooth was? A
Hmm.
large piece of calculus. So,
Like on an anterior tooth? Like how did she
yeah,
feel?
lower anterior.
Yeah.
Yeah. Yeah. And I'm like, ma'am, this is tartar. She's like, how could that be? And so it was terrible because it was like you could still put it back to, put it back in place, so to
Oh
speak.
my gosh.
Yeah, yeah, one of those kind of things. So, yeah, that was not an emergency. I had another one where, now granted, I'm old enough that this was in the days before we have our entire practice on our phone with, digital
Right.
records and stuff. But there was another woman who was a drug shopper who called me in. And
Yep.
so I can tell you in all candor, outside of my residency, not one of the emergencies that I came in for was an actual emergency. Not one.
Mm.
Not one. Now, granted,
And
there
I'll
weren't
tell you
that
this,
many.
I did 80% surgery the last 10 years
Mhm.
of practice,
Yeah.
and I probably only had one emergency patient.
Yeah.
And that's including doing sedations, doing wisdom
Yeah.
teeth, doing sinus lifts, doing
Yeah.
bone grafts, multiple implants. Really only one, and it was a bleeding one,
Hmm.
you know. And yeah, we have to know that we're allowed to say no, or we're allowed
Yeah.
to say, yes, I could see you tomorrow.
Yeah. Yeah.
And again, in order to set boundaries, you have to be willing to lose a patient
Hmm.
and know that if people are not willing to wait, they're not a reasonable patient that has realistic expectations too.
That's
Because
true too.
because like I wouldn't call up my MD and say you have to see me right now because my stomach hurts, right?
Well, you go to the ER.
Exactly. They're going to say go to the R, which is made for that, right?
Right.
And with a private practice that reserves specific amount of time for patients, they have to understand that you can't always see them right then and there or that day.
Yeah. It's true. But and look, let's call it let's be hyper realistic relative to when you're on the phone with that person on the other end and they're all charged up, emotional and stuff. It's not an easy thing to deal with.
No,
And
it's
it's
not. No.
very hard to say no, right? And so I bring this up only to say, going kind of back to what you said earlier about our own personal boundaries, we have to have a clear understanding inside our own heads and or the heads of our associates if we're an owner doctor, what qualifies as an emergency period
Hmm.
and nothing else will bring us in other than X, Y, and Z. And I can tell you also like you said earlier, it doesn't matter what the decision is in life. It's a clinical decision, it's a business decision, it's a personal decision. If you've taken the time to think ahead of time that if this and this and this happens, then I will deal with it. And if it's anything outside of that, I'm not going to, it makes the decision a whole hell of a lot easier.
Hmm.
Both literally and emotionally. Both.
Yeah.
Both. 100%.
Okay, well let's bring this into land.
Yeah.
When I think about this, the learnings that I have with avoiding the guilt are
Hmm.
number one, knowing what your values are.
Yep.
Number two, prioritizing those values.
Hmm.
This makes these decisions a lot easier.
Yep.
Not easy, but easier.
Easier. Yeah.
Easier.
Yeah.
And I also think when you learn how to set expectations, how to set boundaries with people, and how to
Hmm.
communicate,
Yeah.
all of this becomes easier. And if you want to learn how to do any of those, come and hang out with Martin and I. I mean, we have
Absolutely.
online courses, in-person courses, private coaching. You can look at the links in the show notes and know how to get a hold of us. But that's what we do. We help people with those. Any
And
final thoughts, Martin?
yeah, I was just, you know what I was thinking of? I was thinking of the guilt element that we kind of didn't touch on this time, although we talked about this in other podcasts relative to stuff you got to do, right? It's Saturday
Mm,
afternoon. It's like, I got all this stuff to do. And so it's on your head. Well, that's where systems come in relative to understanding your work task burden,
hmm.
which I talk a lot about in my online course. But the point is that, we until our time on this earthly plane is up, as business owners, you're always going to have something to do. And
Right.
so we have to get comfortable with that. And so
Yep.
if we acknowledge that, then the next step is creating systems around capturing everything that needs to be done, prioritizing everything that needs to be done, scheduling everything that needs to be done, so that on a Saturday afternoon, when you're doing whatever, you're not burdened with the self-imposed emotion, aka guilt, because our systems aren't in place. So there's more on that on my website and my online courses, but it's something I suffered from a lot for many, many years. That's why it's so near and dear to my heart. Because you're always going to have stuff to do. And so there's a cost to worrying about it on the weekends versus having a system to account for it next week and then putting it aside, not having to worry about it. Again, very simple, not easy.
I actually did that today.
Yeah.
When I called you right before
Uh-huh.
we were going to record, and I was driving back. I was at the hockey shop. I was
Ooh.
doing looking at some new pads. I'm updating some of my pads so that I can play again with my son. And I had a few hours during my day, and I really wanted to do work stuff, and I really like felt like I needed to do work stuff.
Hmm.
But then when I evaluated things, I said, this doesn't need to be done today.
Right.
And it's important that my son thinks we're playing hockey on this weekend.
Hmm.
And I had to get these pads before this weekend. And I really only had this day to do it because the
Hmm.
rest of my days I'm traveling and I'm totally booked. So I did it. And it was just because I took inventory. I knew
Yep.
when things were due. And I felt like, okay, yeah, I can go do this now.
That's awesome. Yeah, that's exactly what I'm talking about. Yeah.
Yeah,
Yeah.
great.
Awesome.
Great, guys. We appreciate you hanging with us. And we hope to see you on the next episode of Wellness and Dentistry.
Bye-bye.